Welcome to Unlocking Potential, a Red Door Pediatric Therapy podcast. We're your hosts, Heather and Kelli.
With master's degrees in speech-language pathology and decades of pediatric experience, we've been the co-owners of Red Door Pediatric Therapy since 2006.
On this podcast, we share stories and strategies that can unlock the potential of functional, behavioral, emotional, and social development in children today.
Today's guests are Hayle Hauser and Kelsie Schaefer, occupational therapists at Red Door Pediatric Therapy.
Hi, Kelsie and Hayle. Thank you for joining us on the podcast episode. We're super excited to have you. Kelsie, tell us a little bit about you and your background.
My name is Kelsie. I graduated from the University of Mary in 2017 with a master's in occupational therapy. After I graduated, I moved to Dickinson, where I did early intervention and then outpatient pediatrics. I moved back to Bismarck, which is my hometown, recently, and started at Red Door, which I'm so excited about. And I've been working at Red Door Pediatric Therapy for about 8 months.
Awesome.
Hi, my name is Hayle Hauser. I am a pediatric occupational therapist at Red Door. I've been working there for about 3 years now. I'm really enjoying my time and the energy that these kids bring daily. And then recently I became certified in April with my perinatal mental health certification.
Yeah, and that is what we're focusing on today because this is one of the newest services that Red Door has to offer and a really important service to add to kind of our repertoire as we look at how we meet the needs of parents and families. And both of you were recently certified in perinatal mental health. Hayle, what is that?
Yeah, it's looking at a time in life from conception to birth and then a year after birth, looking at the mothers and fathers and just their mental well-being during that time. There's just a lot of changes happening, so just really focusing on that time period.
So you guys are occupational therapists, not counselors. So how does that work with perinatal mental health?
So both counselors and occupational therapists can become certified in perinatal mental health through Postpartum Support International. Occupational therapists have a background in treating the patient holistically, which means their entire well-being, whether it be internally, environmentally, family, and occupational therapists can work on building those skills to help you succeed in what you're going through, where counselors maybe work on more of treating past trauma or events that have happened in the past.
I see.
That is interesting. It is difficult to have a baby. A lot happens in the time frame leading up to it. There's a lot of feelings associated with it, a fair amount of anxiety and stress.
A lot of advice from many people.
Right. And I think that first year is difficult to navigate for even the people that sort of handle it what appears to be the best. How would a person know if they needed this service?
Yeah, so I feel like when you just don't feel like yourself, like you just know in your gut that there's just something not quite right. Other people will notice it as well. You're probably not completing daily activities like typically you would. Maybe shutting down more, being more distant, maybe more panicky or more anxiety related to it as well. But yeah, you're just gonna know just in your gut. I've talked to many mothers and they're just, something's not right. Something is not right.
It just was harder to get motivated to kind of do the basic things like shower or make a meal or unload the dishwasher or even just kind of the things that were routine in your day feel harder and more overwhelming?
Totally, like just to take a shower is just a lot of work. Sleep is a huge impact on mental health and just your overall health and wellness as well. And we're not sleeping when we have to take care of a child. And the baby's temperament has a lot to do with it as well. If you have a more colicky baby, it's just going to be harder to handle.
What would a new parent expect when they come in our door? What would those services or a session look like?
So we welcome mother, father, and baby. If mother wants to bring the baby, or some mothers choose to leave baby at home and have this time just for them, they can come in and we run through, how are you feeling? What is going on? Tell me about your day. All of the occupations that they have. How is your bonding? Which is sometimes nice if baby does come. We can watch mother and baby bond together, or maybe mother and father bonding together with themselves. we work on a lot of mindfulness, coping strategies. What are you needing help with? It's very mother-led, and then we just assist with what are their difficulties that they come up with.
Sure. So I think some people have kind of a preconceived notion or a stigma about maybe what a therapy session looks like. And what you're saying is it's kind of just a time to regroup and take stock on kind of how everything is going, how the relationship is progressing within the home, how they're feeling inside their own body in terms of all of those changes, how they're feeling in terms of motivation and being able to kind of handle the tasks that are given to them on a daily basis. It is a lot of work to have a new infant. And I think that once you're kind of past that, you forget it. But when you're in the midst of it, I remember being like, what? Nobody said that it was this hard, and nobody said that it was this constant. And those were things that I probably in hindsight wish I could have or would have asked somebody about.
So for parents with newborns that are not getting a great amount of sleep and it's eking into their daily living skills to a point at which it's worth seeking services, what are some of the strategies that you provide for them that they can try at home?
Some things we can do is just for them to advocate for themselves. I feel like a lot of mothers just think they can do it all themselves. Like, I don't need help, I can do it all. So really just asking for help, seeking those support people. Maybe it's your partner, maybe it's a grandma or a mom or whoever. So just really advocating for themselves, maybe making some kind of schedule or routine to set time aside just for a couple hours just to get some sleep. So I think that's very important to just advocate and to find your support people.
Absolutely. That was me. I just didn't want any help from anybody else. And obviously that sets you up for some difficulties later on. Do either of you have personal experiences with that?
I do. After my son was born about 3 years ago, I was struggling. I was having a lot of anxiety, and people told me, well, that's normal. You're doing fine. Keep going. But here I was sitting up all night long watching him sleep on the monitor. And my husband said a few times, go to sleep. He's okay. I'm like, but what if he's not? Mm-hmm. What if he's not okay? Then why I go to sleep and I wake up and he's not okay? So I sat there and I watched him, and I wasn't getting sleep. It was impacting then the next day, crabby, irritable, blowing up on others when they just even walked by me. Just wasn't myself, and I didn't know where to go. And yes, we have our checkups and stuff, but I was one of those that marked everything's fine. Everything's going great. I'm okay, when I wasn't.
Sure. So we're kind of asking people to take an honest look at their situation with the idea that if you do that, it's so beneficial in the long run, because then you can avoid a lot of the anxiety, a lot of the guilt, a lot of the sort of negative feelings that come along with the situation that you just gave as an example. One of the questions that we get a lot at Red Door for almost every service that we offer is, how long is this going to take? Partly because it gives an indication of how much is this going to cost, but also I think people want to know what to expect in terms of a timeline. That is always the magic question, but do you have an answer? Do you have an estimate?
I feel like that's a hard question to answer, but if you think about that time frame, that perinatal time frame, it's like the first year of birth and life is kind of where we see most individuals. Sometimes we see them before when they're pregnant, but mental health, it impacts people in the long term. So maybe they see us for a little while and move on to counseling long term, or maybe to medications. It's really hard to give it a straight answer for that.
So if a parent is not recognizing themselves that they're beyond what would be considered normal for having a newborn at home, who are some of the people in their environment that might notice that there's something off?
Partners or spouses, doctors or OBGYNs at your follow-up appointments. Again, it's important to be honest and open with them. Other family members such as your parents, brothers, sisters, cousins, anybody that you're around.
So when is it an appropriate time for someone to seek help?
I think as soon as you notice that something is off, you hear about the postpartum or the baby blues. So that's typically in that first 2-week window. But anything after 2 weeks, we know that something's not quite right. Also, which is kind of interesting, that 3-month mark after the birth is kind of when you see an increase, which most women go back to work during that time. So coworkers might also notice some of those things as well. But if you just notice after that 2-week mark that something's not quite right, I'm not myself, I can't get anything done that I need to get done, and other people will pick up on it rather quickly, the whole family unit in general is just impacted.
I think that's a great point, because much like almost any service that we offer, sometimes parents are taken aback by a suggestion that maybe something is not quite right. So if their mom or their, an in-law or their sister or their friend says, hey, I think you're not quite yourself, or something's not quite right with you, or I've seen these changes. It's a lot like the conversation of, hey, something might be going on with your kid and you should maybe seek services. I think that part of what we're trying to do with this topic and this conversation is sort of debunk the myth that you have to be okay, and to help people bring their defenses down and ask for help in a way that feels sort of systematic, like there's a plan in place and there's a really well-connected professional to seek out. And that, I hope, would help kind of just decrease the anxiety or any unsure feelings about seeking treatment for these services, because I just think it can really, really make life easier for moms and dads and babies and the home life in general.
And I think it's important to talk about the benefits of seeking a service like this. Things like getting along better with your spouse, or being able to be patient for situations that are normally come up during the day. So Heather, this is kind of a question for you. So if an individual goes to their doctor and says, I don't feel like I'm quite right, and the professional says to maybe wait and see, what would you recommend?
Well, I don't like wait and see. I don't like it in any aspect of what we do. I think movement toward an answer is better, even if the answer is, you're doing really great, you're doing okay. I don't know in this situation if that would typically, be the feedback we would provide. But I just think, much like everything else, and much like you said, go with your gut. If you're not feeling like yourself, you're not required to have a physician referral to seek out this service or to have your insurance pay for this service. So the referral from your primary physician, your OBGYN, or even the pediatrician, if you brought it up at a well baby visit, isn't required. They're just sort of a stopping point along the way that asks questions about kind of your overall mental well-being in terms of the perinatal process. But it's your choice to make. And we encourage people to move forward on it and at least seek out to determine if this is a great fit or not.
So as we wrap up this episode, what would you say to parents who are perhaps a little nervous about making contact?
So we like to have fun at Red Door Pediatric Therapy. It is a lot of fun. And although it is a formal service, it can be informal as well. Come in, bring your coffee, bring your babies, whether you are a mother of 6 or this is your first child. Come on in. We would love to chat with you and see how we can be of help.
Thank you, too, for coming on this episode and talking about perinatal mental health. I think it's an important topic.
Absolutely. We appreciate the time and energy you put into it. And as always, we appreciate all you do at Red Door.
Thank you for having us.
Thank you.
Thank you for listening to this episode of Unlocking Potential, a Red Door Pediatric Therapy podcast.
Please like and subscribe for more interviews and content, or connect with us online at reddoorpediatric.com.
Thanks for joining us. And remember, communication is key to unlocking your potential.